So, ladies and gentlemen, I'm going to talk to you about the Belgian national strategy, lessons from the past and a glimpse to the future. I begin with my first slide, and there already are some inaccuracies in it. It says the Belgian national strategy 2007-2012. Actually, it started in 2008, and since we don't have a new one, it didn't stop yet. Currently, we are evaluating it, but the action goes on. You can find the whole strategy, the whole document on the agency's website. I'm going to say some things about the current one, and then some things about our evaluation of it, and some things about the future. So, the context of this strategy was we saw that the diminution, the decrease of work-related accidents stagnated. We saw that the highest number occurred in the service sector, the construction, healthcare, and the non-profit. There were a lot of reasons. I've summed up some of them: the lack of experience, the personnel flow, short-term jobs, the complexity of the workplace, the lack of communication, bad machine security, and the high workload, and of course risk behavior. Now, the strategy's reason to be why. Well, Europe came up with the strategy, so we in Belgium, we wanted to be good Europeans. We did the same. Of course, that's not the only reason. Why a policy on occupational health and safety? Well, it's simple. We don't want that workers get killed, injured, or get sick on the workplace. Along with that, we want to have competitive and productive enterprises. And a third reason is we want to reduce the costs of the social security. So we come up with a strategy. Why a strategy? Because a strategy is a more coherent approach. We already had an OSH policy, we had a lot of legislation, inspection, social dialogue, campaigns, research, tools. But we thought we needed to have more structure in that, actually, to have a more, as I said, coherent approach. What were the points of interest, of attention? Well, we wanted to reinforce prevention, changing behavior, fortifying control and inspection. Of course, we give priority to risk sectors, directing a large-scale research, and putting the accent on workers in transition. That is, as you know, the crisis occurred, so there were a lot of changes on the work market. Further from that, we had attention to new risk groups. We wanted to do it in consultation with the social partners, and get to a culture of constant evaluation. You can resume it that in 3 objectives. So, reducing the number of accidents in the workplace. We also set by 25%, like in Europe. Encourage changes in behavior of the workers by promoting a culture of risk prevention, and improve the functioning of the prevention services. This all ended in a strategy. It was composed of 5 programs that got different projects and multiple actions per project. I have them all summed up in my presentation, but as I said, you can find it on the whole strategy on the website. So To be brief, the first program was fortifying the prevention of occupational diseases and work-related accidents. This resulted in a lot of different projects, and those projects resulted again in action. So I mentioned improving the efficiency of the services, reinforcing the prevention of work-related accidents, and so on. You can all read it. I am going to be very brief about this. You see tackling new risks, improving the coherence of policy guidelines, improving the well-being at work, and permanent evaluation. And the next slides do mention all the rest of the programs and projects of the current strategy, but I won't read them all out loud. That's not very interesting. And now we are currently evaluating it. This is interesting to look what went okay and what went wrong, because we did learn some things about our strategy. So we looked at the status of the implementation, the impact, and the effectivity. What are the first findings? So a national strategy is an attempt of the government to do some public management to justify their actions and in a structured way. It's a willingness to show the capability to achieve objectives, as I said, and by trying to manage the fragmentation of competence. This is important, but also to ensure the involvement of the whole community, to restyle structures, procedures, and resources, focusing the action on predefined priorities and determining evaluation and adjustment means for mid and long term. It is a political engagement. This strategy was coordinated by the Minister of Labor at the time, because now we have a different minister. There is a clear influence of the European strategy. Europe was a driver for Belgium to make our own strategy. So we're looking forward to a new strategy of Europe. But we realized that there's a difference between doing an inventory and a categorization of all our actions, the current actions, and put them in a strategy, or really restructure everything, rethink everything. Another finding was that we were wondering if we have to look at, if we had to take measures for prevention structure more on a larger scale, or do direct measures reducing risks. Also, what is a strategy? Is it a declaration of good intent, and we the government, we want to tackle all risks, and is it vague? Or on the other hand, maybe sometimes it can be too detailed. When we were here very detailed, and afterwards we see that it's sometimes difficult to manage that and to evaluate this. It needs political support all the way. As I said, there's always a change of ministers, and there has to be a good follow-up. And we also saw that it's very important to have some bottom-up action when establishing a strategy, to consult all stakeholders, all social partners, not the opposite, top-down, so we make a strategy and then we go to all of them and say, okay, there's a strategy, let's do it. This does not work. If there's large consultation, there you get acceptance, legitimacy, and coherence, and above all, ownership by all stakeholders. It's important to think when establishing a new strategy about evaluation. I mentioned zero measurement. That means measure the situation before starting the strategy. Define criteria and indicators to measure. And that's not really simple. You can say, okay, we can look at the number of accidents, the number of occupational diseases, and try to reduce the number. Okay, that's one thing. But maybe you can also check, okay, what do we have from legislation? What do we need to change? How does our inspection work? And that has to be put in clearly measurable indicators. That's not that easy. It also requires a periodic evaluation during the strategy. A lot of mid-evaluations, so that the strategy can be adapted. It has to be dynamic. And we also saw that it's very important to communicate on the strategy, not only in the beginning, so from hi, we have a strategy. No, it's important to communicate of all progress in the strategy on a regular basis. And of course, coordination is very, very important too. We had one guy that was appointed to do the coordination, but that wasn't easy for him because we didn't see him a lot during the strategy, and maybe he wasn't supported enough too. It's important to have high-level coordination on a strategy. So, of course, we are already thinking of a new strategy. We will look at our old strategy and see what has to be continued and what not. But we also look, of course, at a new European strategy. Then, like I said, during the evaluation project, we contacted different stakeholders, and not only to evaluate, but also to have suggestions of them from the field. And of course, we consult the social partners and other stakeholders. Yeah, I put this slide in it. It's the table for our new strategy. We will have different categories of objectives and means of action. So strategic objectives, operational objectives, and proposed actions. They are, of course, defined. There will be also this time clear evaluation indicators, because now doing the evaluation, it's not always easy to have good indicators that tell us something, and the actors involved. I give you some examples of teams, but they are neither definite nor exhaustive. It's reintegration at work. This will be very important. We also will focus on job maintaining of all workers, but specifically older workers. Then psychosocial risks and MSDs. Those are the two main reasons of absence at work. We already are tackling them a long time, actually. We will continue with that. And then I've mentioned some other points of interest, like, of course, SMEs, and therefore we're going to promote OIRA in Belgium. The new risks, I mentioned faults in my presentation. I said nanomaterials. Nana is grandmother in English, and it's also slang for a girl in French, but I mean nanomaterials, of course. And this is I mentioned some other examples, but of course you know them. I think they will all ring a bell, like Lupcho did too. So thank you for your attention. Fala.